Bienvenue, karibuni, welcome to the Accountability on African SRHR online course. This course is brought to you by Accountability International, the AIDS Foundation South Africa, and the Sex Rights Africa Network. Today we'll be looking at global commitments. Our learning goals are to be able to identify the foremost relevant global commitments on SRHR and to be able to explain why these 4 commitments are relevant to African SRHR work. Our estimated time is 45 minutes. The number 1 global commitment is Sustainable Development Goals. A bit of a background. The Millennium Development Goal, MDGs, were the output of a meeting in 2000 where 189 heads of state adopted a declaration in which a need of collective responsibility was expressed to work towards a more peaceful, prosperous, and just world. The SDGs, whose main objective was to be an inclusive and transparent intergovernmental process open to all stakeholders with a view to developing global sustainable development goals to be agreed by the General Assembly. Goals 3, 5, and 10 of these SDGs are the ones most usually associated with SRHR. But because SRHR cannot be separated from the real lived experiences of people, we need to include a brief version of all 17 goals here too. Do the goals have a relevance to SRHR? Of course. For Africa, the post-development agenda should also reflect Africa's priorities and development programs and should place, quote, sustainable development at the core, end of quote. Some of the priority areas included are the need for investment in children, youth and women, investments in education and health, and need to provide universal access to affordable and quality healthcare. Our next global commitment is the ICPD Plus 25. A bit of a background. In 1994, the United Nations convened the International Conference on Population and Development, ICPD, which was held in Cairo, Egypt, and, quote, considered the broad issues of and interrelationships between population, sustained economic growth, and sustainable development, and advances in the education, economic status, and empowerment of women, end of quote, and was, quote, explicitly given a broader mandate on development issues than previous population conferences, reflecting the growing awareness that population, poverty, patterns of production and consumption, and the environment are so closely interconnected that none of them can be considered in isolation, end of quote. What then is the main objective of ICPD Plus 25? Quote, the objective is to raise the quality of life for all people through appropriate population and development policies and programs aimed at achieving poverty eradication, sustained economic growth in the context of sustainable development, and patterns of consumption and production, human resource development, and the guarantee of all human rights, including the right to development as a universal and inalienable right, and an integral part of fundamental human rights. Particular attention is to be given to the socio-economic improvement of poor women in developed and developing countries. As women are generally the poorest of the poor, and at the same time key actors in the development process, eliminating social, cultural, political, and economic discrimination against women is a prerequisite of eradicating poverty, promoting sustained economic growth in the context of sustainable development, ensuring quality family planning and reproductive health services, and achieving balance between population and available resources and sustainable patterns of consumption and production, end of quote. What then is the relevance of the ICPD global commitment? Since then, several African countries have made significant progress. Fewer women were dying in pregnancy and childbirth. Skilled birth attendance had increased by 15% worldwide since 1990. More women had access to education, work, and political participation. More children were going to school, and few adolescent girls were having babies. We now examine our third global commitment, which is the Global Strategy on Women, Children, and Adolescent Health. A bit of a background. The previous global strategy managed to get many political leaders on board with financially committing to the health of every woman and every child, and the broad-based stakeholder engagement that the strategy brought yielded good results in improving the good quality health services and education, sanitation, water and clean air, and good nutrition. Many still do not have even these basic needs met. In order to ensure the achievement of the SDGs and accelerate the achievement of equal access to quality health, a new strategy was put in place in 2016. The strategy describes its objectives as 1. Survive by ending preventable deaths by reducing global maternal mortality, newborn mortality, under 5 mortality, end epidemics of HIV, tuberculosis, malaria, neglected tropical diseases and other communicable diseases, and reducing by 1/3 premature mortality from non-communicable diseases and promoting mental health and well-being. Its second objective was to thrive by ensuring the health and well-being by ending all forms of malnutrition and addressing the nutritional needs of children, adolescent girls, and pregnant and lactating women, ensuring universal access to sexual and reproductive health care services and rights, ensuring that all girls and boys have access to good quality early childhood development, reducing pollution-related deaths and illnesses, and achieving universal health coverage. Its third objective was to transform by expanding enabling environments through eradicating extreme poverty, ensuring that all girls and boys complete free, equitable, and good quality primary and secondary education, eliminating all harmful practices and all discrimination and violence against women and girls, achieving universal and equitable access to safe and affordable drinking water, enhancing scientific research, providing legal identity for all, and enhancing the global partnership for sustainable development. Its relevance to SRHR, you may ask? Health system strengthening brings collateral benefits. Employment opportunities in health and social care can drive broader socioeconomic development, improve gender equality, and lead to youth
Finally,
empowerment.
we look at the Beijing Plan.
Plus 25. A bit of background. More than 20 years ago in 1995, at the 4th World Conference on Women, a vision for a more equal world was set out in the Beijing Declaration and Platform for Action. Back then, women's rights activists highlighted the need for gender equality and informed the world of the human rights that were systematically being denied to women globally. These activists highlighted the need for law and policy to change so that women and girls would be treated equally, have better access to rights, and to do so, they demanded that both formal and informal institutions needed to change dramatically. The main objective, of course, is an agenda for women's empowerment. It aims at accelerating the implementation of the Nairobi forward-looking strategies for the advancement of women and at removing all the obstacles to women's active participation in all spheres of life through a full and equal share in economic, social, cultural, and political decision-making. A transformed partnership based on equality between women and men is a condition for the people-centered sustainable development. A sustained and long-term commitment is essential so that women and men can work together for themselves, for their children, and for society to meet the challenges of the 21st century." End of quote. In 2019, we can look to the Beijing Declaration and Platform for Action, TAN's Trade Summary Report, to provide an analysis of how countries are performing and implementing the Beijing Declaration and Platform for Action. It looks at the successes and challenges being faced at country level, the strengthening gender equality and empowerment of women in the post-2015 development agenda through the integration of a gender perspective as mandated in the Economic and Social Council Resolution of 2013 to 2018. Is Beijing Plus 25 relevant? Definitely. Health covers physical, mental, and social well-being, as well as the absence of sickness and infirmity, and is determined by the social, political, and economic context of people's lives, as well as biology. Finally, it is time to assess yourself. What are the 4 most important global commitments on SRHR that you can remember? Can you also name the objectives of each of the commitments? And is it possible to see what objectives do these commitments all have in common? Thank you very much. And if you want to get to know more, please get in touch with us.